Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. If you're just joining us, we've been discussing the AIDS Resource Center of Wisconsin. Our focus has now turned to a prescription drug known as PrEP. In cities like Milwaukee, there are huge disparities in who's impacted by HIV along with who assesses this drug. And here to tell us more about the Stay Prepped Up campaign is Tiffany Wynn, who's the Director of Marketing and Public Relations at the AIDS Resource Center. And we're being rejoined by Mike Gifford, who's the President and CEO. Welcome back, Mike.
Thank you.
Hello, Tiffany.
Hello. Thank you for having me.
Thank you for being here. And we've been discussing the many services provided by the ARCW. And I'd like to find out more about this awareness campaign that was launched called Stay Prepped Up. But first, I think it's important to establish what is PrEP.
So PrEP is an acronym for pre-exposure prophylaxis.
Okay.
And the idea is that if you're at high risk for HIV, engaging in unprotected sexual activity, that you take the medication. It's one pill once a day, and it has more than a 90% effective rate in protecting you from contracting HIV in the first place. It's one of the most powerful ways that we can bring HIV and the epidemic to an end, and we need to get PrEP out to all the patients who can benefit from it.
Wow. So when we look back at like all of the research and all of the things that have taken place over the years, this is probably one of the things that researchers are most proud of.
It's probably the most significant breakthrough in the history of the AIDS epidemic. And for those of us who remember the early days of AIDS, this is what we would have given everything for. Right? This would have saved all of our loved ones and friends who contracted HIV in the first place. Sadly, more than 90% of Americans who need access to PrEP don't have it. And it's far worse for members of the African American community and the Hispanic Latino community, and that's why we've focused the new Stay Prepped Up campaign on the African American community.
All right, and Tiffany, that's your cue. Tell us more about this campaign.
Yeah, so we launched the campaign in June, which was in honor of Pride Month. The reason that we chose the targeted demographic that we chose, which is African American, gay and bisexual men, and Black trans women, ages 25 through 34, is because research tells us, according to the Centers for Disease Control and Prevention, that 1 out of every 2 of them will have HIV in their lifetime nationwide. And that's compared to 1 out of every 4 Hispanic and 1 out of every 9 white gay in terms of their counterparts. So, and in Milwaukee alone, according, there was recent research from the Medical College of Wisconsin, just in Milwaukee, African American gay men contract HIV 4 times higher than white gay men. So those are alarming statistics, and that's why we want to focus this campaign on that specific demographic, because it's important that they know what tools they need to prevent themselves from contracting HIV. It's important for them to take control of their health and to be aware and educated, and that's what this entire campaign is about. It's all about education and awareness of this one pill you take once a day to help prevent HIV. And that's why we call it Stay Prepped Up, because we want to make sure that they are staying prepared as they go throughout their life and they live their life without fear, without stigma, and doing everything in their power and in their control to take control of their health.
And so even though you are specifically targeting LGBTQ men and trans women of color, it's important to relay the message that to young people that this prescription is for anyone who's sexually active and HIV negative, regardless of age, gender identity, or sexual orientation. And this is, like you said, a breakthrough, but what are you having to do in order to make sure that message gets across?
Absolutely. So right now we do believe in inclusivity when it comes to PrEP, right? So we make sure that we target all communities as well, just in terms of getting it out there. So in terms of the marketing behind it, we have reached all zip codes throughout the entire county of Milwaukee. So we want to make sure that it's reaching all people. And the messages that we're putting out there about it is really just more about education and accessibility. So we're making sure that people are educated about it. So even through our website, all the marketing materials that we've put out there, we're making sure that we're addressing all frequently asked questions around PrEP. We have a line that people can call, and they can even remain anonymous, but they can talk to a live person about any question that they have about PrEP. So we're making it as easy as possible for people to come to us and get all their questions answered about it, so they can find out if it's right for them, because we want to make sure that we're helping and aiding them in making that decision.
Okay, and so what I think that you've done a great job at is really having ambassadors to kind of help spread the word. Gifford, and I'm guessing these ambassadors come from all different walks of life and have different scenarios of where they feel like they want to help spread the message.
Yeah, I think this campaign is so unique, Andrea, because it is really focused on the African American community, which makes up, sadly, more than 80% of new HIV infections in the city of Milwaukee.
Wow.
And it is designed, created by young African American leaders like Tiffany, 5 in front of the camera, 5 behind the camera, based on research done with individuals at highest risk for HIV in the community. This is a campaign for the Black community, created by the Black community to save the lives of young Black youth in Milwaukee.
Wow.
Really making it very unique.
And it really says so much, and you've put together a number of videos and ways for people to hear from these individuals. So I say we take a quick look at one of those.
Yes, absolutely.
PrEP is used as a tool, as a proactive tool, to keep you healthy and to keep you HIV negative. And taking it a step further with people who are living with HIV themselves, it's very, very, very important for the person who is HIV negative to take PrEP, because that assures a healthy relationship. But it's discussions that we need to have as a community involving PrEP.
And it's a genuine duality as well. It's you, it's your partner, it's making the decision that you guys want to live the best possible relationship you can, without fear, without stigma, and hopefully in love.
And there's power in that.
All right, so it's powerful because, like I said, there's one thing to have, experts talk about things, but when you get everyday people who have everyday stories to share, it really makes a difference. Would you agree?
Yeah.
Yes, so these are real people in our communities who actually have shared their experiences of being on PrEP and their perceptions and their realities. And we thank them for that because it's peer-to-peer, right? People, it makes the campaign more credible when you hear from people that look like you, that are in the same position as you, who can share your experience. And you say, okay, if that works for them, then more than likely it will work for me as well.
Yeah, numbers from the Centers for Disease Control and Prevention show that PrEP can help reduce someone's chance of getting HIV through sex by more than 90% and getting HIV through needles by more than 70%. So I'm thinking if you fast forward 20 years from now, there is no telling where we could be when it comes to research, right?
Absolutely. I mean, this is the fast track to the end of the AIDS epidemic, right? And even 10 or 15 years ago, we would have never been able to envision the end of AIDS in our time. But between the effective treatments that we talked about earlier and PrEP that we're talking about now, we really have a chance in the next generation to get to the end of HIV and AIDS. But there's lots of barriers. The stigma we talked about, misperceptions about the financial cost of care, which Tiffanys Campaign is helping overcome, and just sort of the ongoing concern that people have about identifying with HIV and AIDS. So as soon as we break through all of those, I think we're going to see the floodgates open in terms of the number of people who are on PrEP. In fact, early on, we're already seeing a nice uptick of about 25% based on this campaign of new patients. So we're really excited that not only is it a really powerful campaign, but it's having an impact in terms of more people walking in the door to talk to the doctor, get the medications that we know are going to save their lives.
Yeah, and one thing that I know you guys probably drive home all the time is just because we are seeing, progress, that does not mean that people can get laxed and, decide that they don't need to protect themselves. Protecting yourself is an ongoing thing that you shouldn't even think twice about, but it is just really hopeful to hear such great news.
Yeah, and it's easier to protect yourself from HIV now than ever before.
Right.
So as we wrap up this segment, Tiffany, what can we as a community do to help educate about HIV and STIs, in your opinion?
Well, one thing that we aimed to do through the campaign is just normalizing the conversation about PrEP, right? It shouldn't be a conversation that's just reserved for the doctor's office. You should be able and comfortable enough to talk about PrEP and your sexuality and your preference with your family and friends. We have to replace stigma with support because we have to make people comfortable with who they are, because then that leads to them having more self-esteem, knowing that their health is worth it, and being more worthy of what they need to go out there and do. So we have to, as a community, come together and replace that stigma with support and make people comfortable with who they are.
Well, that's one of the reasons why I feel it's important to have you here today. So thank you both so much for being here and for all that you do.
Wonderful. Thank
Thank
you.
you.
Michael Gifford is the president and CEO of the AIDS Resource Center of Wisconsin, and Tiffany Wynn serves as the director of marketing and public relations. To find out more about the Stay Prepped Up campaign, visit staypreppedup.com. When we return after the break, we'll be joined by Dan Mueller, who will fill us in on everything we need to know about this year's AIDS Walk Wisconsin and 5K run. We'll do that right after this.